everyone.
We're live from Las Vegas with Dr. D himself. What's up, Dr. D? And Ryan Lewis of Global Cannabinoids.
Say it five times. Say it 5 times.
And we have a special guest.
Furcini.
Ryan
How
Furcini
goes it, sir,
of
from
Star
San Diego?
Nutra Manufacturing. What's up, Ryan?
How's it going? Excited to be here.
Yeah.
Excited to have you.
Thanks for joining the team, Furcini. So we're going to set this up. We have two Ryans here, actually, along with little old Dr. D. And we're going to call Ryan from Global. All right, Ryan tonight, so everyone can keep track. And then Furcini is Ryan from Star in San Diego. So guys, I think this is really an awesome talk for two reasons. First, because I know you guys for a long time and through a couple of really exciting periods of my life when I met each one of you. And then two, it's freaking awesome to be in a cool collaborative environment where three guys from the same industry that are doing similar things, right? We're all building brands or making products or whatever, are literally sitting here talking about all the awesome stuff that we can all kind of do together and sharing knowledge. And it's not some, angry competitive vibe.
No, but what's cool about this
awesome.
is this is exactly what we do like normally.
Right. It's
so
normal.
We're just sharing it with the viewers and the people that we're going to send this to.
Yeah.
Yep. So just a little housekeeping. We're going to be talking about CBD manufacturing and skincare tonight. If you have any questions for any of the guests here, go ahead and answer them below.
Yeah, everyone. So to briefly, again, introduce Ryan Lewis from Global Cannabinoids. He is a world leader in developing the B2B as well as brands in the space, high-end GMP, FDA registered manufacturing, all that sort of a thing. And I had the pleasure of meeting Ryan several years ago and beginning to work with him to provide some of the products that we sell in Dr. D. And it's been a real pleasure. And then as well, we have Mr. Ryan Furcini, who I've also had the pleasure of working with in another facility that does similar things to what Global does. And, guys, I think it's a great place to just jump into it of what are some of the new things that we have seen in the manufacturing world of where the industry's heading. And then I kind of want to talk about some of our more funny times in the lab where we've made some mistakes or we've seen some funny things and kind of share, some of our struggles and successes with people out there.
I think, the reality is that, this is really, the industry is really moving out of the Wild West.
Yeah.
Right. And into much more oversight, transparency. And it's going to be, really important now that, your products are manufactured in a facility that's not only regulated, but, run by competent people. And, finally, the last part of the equation is people that actually care about the products that they're making, because as you know, Dr. D, people are relying on these products for their health. And Furcini knows that. That's why he's down there at Star Manufacturing, San Diego. Great group of guys. Yeah.
Hey, Furcini. So, give people out there a little bit of an idea, right? Ryan and I know what it's like, but what is it like in a day-to-day life of someone that is involved in the space, right? I know you very well, and I know that literally every day you're going to a certain facility, and kind of what does that entail? What do you do there? And you're out there going to some conferences too. Like what is a day in the life of handling CBD brands mean?
It's a heavy load. Honestly, I liken it to, I don't know if you guys ever been in a restaurant in the restaurant industry, being a server. You got several plates in different stages of development. You're taking orders. You got plates in the kitchen getting made. You got plates you got to deliver to the table. We're constantly juggling these orders. So it's just a massive demand to continually keep up with your client demand and make sure that you're constantly.
Okay, so I think that's a good point, right? And this is a topic that I know Ryan knows really well too. Gummies. Gummies are hot, and I have seen some of the the struggles and success of how it is to set up. Everything is simple, right? One of my core businesses, right? Giving out a cannabis recommendation, a simple thing when you do it once. If you have to do it 500 times a day for a whole team of doctors, that's volume, right? So I've seen, Ryan, I know you guys were setting up some really large, or Furcini, some large gummy bear machines, and that has taken, almost a year of hammering that out?
We have 3 machines now, 2 of which are in Texas. We have a crew that's working 3 shifts to keep up with demand.
And how many gummy bears does that make a day?
Oh God, it makes I think the first machine can make 30,000 a day.
Yeah.
Second machine can do 50, and then the machine here is 20.
Yeah.
So we've got all different stages of piloting different recipes, infusing vitamins, other dietary supplements to get all sorts of different effects.
And it has not been easy, right? Like I've seen
gummies are difficult. I mean,
yeah.
I commend you, Furcini, because my business model was, I always I knew I would never be able to compete against the biggest gummy manufacturers in the world, right?
Yeah.
So I just went out and partnered with them.
Yeah.
If you can't beat them, join them. But, gummies aren't that easy to make. A lot of these companies, as you know, they're spraying their gummies. And that's why, with the new regulations and products being tested, not just by regulators, you got, news companies and doing investigative reporting where they'll pull the gummies off the shelf and they'll test it. And anything sprayed is never going to come out accurate. You're going to lose the CBD on the bag. And so,
every surface it touches, you're going to lose a dose.
Exactly.
Yeah.
And so one of the things that I learned early on, because I was one of the first guys infusing CBD into gummies in the country with American grown hemp. And, it was a challenge because like when you put the oil in it, it wants to sweat. And so it took us a while to really figure it out, let alone to get the right gummy that has the right consistency, flavor. But what we started to do was we developed a process that could essentially just remove all the water from the oil and we powderize it. So, taking a powder and then dosing the mixture, and all of our gummies are vegan. So, dosing the pectin with the powder, it produces a gummy that's much more accurately dosed. What are you guys doing over there?
Oh, for accurate dosing?
Yeah, dosing. How are you guys doing infusing your gummies?
We're infusing our gummies with oil. We still actually mix it in. But what we'll do is we'll actually heat the oil to 70 degrees Celsius and then add in Capolex, which is a
thickening agent, right?
A thickening agent, but it helps keep the oil distributed throughout the process. You know what it is? It's about hitting certain thresholds. Mm-hmm. You can mix everything, but until you reach a certain stage of that mix and then get to a certain temperature and then mix it with, You have to mix all the oil together with the first phase, and then you mix it with the sugar and all the other additives in the second phase. But each threshold's got to be exactly perfect, or you'll just ruin the batch every single time.
Yeah, and so as a brand, guys, right? That's why it's so great to be able to all work together here, because I've seen the failures of telemedicine. You guys have seen the failures of gummies, and to be able to do this successfully at scale and provide literally a brand that is being ordered from all parts of the globe now, you have to have gone through this period of failure.
Oh,
right?
God, years.
You have to, because I wouldn't want to go to a manufacturer that's like, hey, I'm going to give you an amazing price. It's lower than all of your people, and we're just starting, because I'm like, that supply chain has been broken and fixed yet. All of our supply chains are broken, fixed, broken, fixed, and are now flow state.
And the other thing about the gummies is that, one of the challenges in our industry is that CBD is an active, and, people are looking for a precise dose. FDA is looking for a precise dose. People are promoting their product with a precise dose. It's not like the gummies that you're buying, these vitamin gummies off the shelf. FDA doesn't care if you're off, 10, 15% on your vitamin C or whatever, So it's a lot more challenging, definitely when you have the spotlight on you.
Yeah, right
True.
on. And so, hey, Furcini, how's San Diego? You're getting a little life balance down there. Are you surfing again, or what are you filling your spare time up with?
Well, outside of being at work, I try to fill it with surfing.
Okay.
And I sprinkle a little bit of cycling in there. I like to ride my bike.
Yeah, I couldn't do that. I always saw too many people getting run over in the ER. But I'll kayak and surf with you. We'll bring the surf truck down in a couple of weeks. We'll throw some surfboards on there and
barbecue.
Yeah. Which beach is closest to you again?
Mine is the break is called Tourmaline.
Tourmaline Beach.
And
okay.
It's a surf break called Old Man's. It's a little slow, crumbly wave. You got to have a longboard out there, really.
I'm a longboard guy too. I'm not that good. Yeah. But yeah, listen, once we get the brand going and we can get Marco to give you a week off, we'll go do a little surfing safari with the the Dr. D truck and sell CBD up and down the coastline.
That sounds like a blast.
It's easy to sell CBD with Dr. D, because anybody that hasn't seen his 4x4.
Oh, it looks so good now with the new wrap.
Borderline rape van.
It is the bug out vehicle, right?
It's got Dr. D CBD all over the van. So it's like
solar panels.
You're driving past people and they're like, "Hey, CBD."
Yes.
That guy has got what I need.
Solar
Exactly.
pan. What's that, Jace?
Yeah, so we got some comments.
Okay, right on.
So Amy says, hi, Dr. D and both Ryans.
Amy from the production lab is watching.
Oh, what's up, Amy?
Yeah, Amy.
Is that my Amy?
Yeah, you're Amy.
Oh,
what up, Amy?
I love you, Amy.
She's
The
so
best.
good. She is. She cares. That's it. She cares, Ryan.
She's the best.
That's it. She's happy.
Shelly Marie says, hi, Dr. D.
Hey, Shelly. Hey. Happy Tuesday.
Amy would like to know if you could discuss manufacturing and not just CBD, but different cannabinoids.
Yeah, why don't we jump into that? So, hey, Ryan from Global.
Yeah.
That's pretty exciting. We've been talking about this a lot, and then maybe Furcini from San Diego can talk about and see what he's heard.
Yep.
But okay, so how about this? So as a doc, right, going to all these conferences around the world, I'm intimately familiar with stuff like, CBDA or THCA or CBG. I mean, Raphael Meshulam in Pasadena, right, at the recent CannaMed conference, like the whole conference was dedicated to a new kind of more rare cannabinoid, CBDA, that folks don't hear so much of. And you've been talking a lot about some other cannabinoids that are coming onto the menu that we'll be able to work with.
Yeah, the rare cannabinoids. I'm
yeah.
obsessed.
So what are some of those?
I'm obsessed with them. So CBD, quite honestly, it kind of bores me these days.
It's everywhere.
When you basically dose thousands of milligrams a day because you're testing products, I think eventually the effects just start to wear off. So you start looking to other cannabinoids to
like CBG
to do
right
interesting
here.
things.
This is one.
CBG is super interesting. But my favorite cannabinoid right now is CBN, cannabinol. And CBN is produced naturally by the plant from the degradation of THC. Cannabinoids convert and, they'll degrade into other cannabinoids. But CBN for sleep is really an unbelievable cannabinoid. I think it's going to revolutionize sleep. And, we're starting to put it into various products. We have CBN soft gels, we do CBN tinctures. And now, utilizing the nanotechnology that we have, you can take the CBN and it'll hit you, much quicker. Yeah. And the thing I really love about nano, and I think I mentioned this to you before, is that not only does it hit you faster, but it leaves you faster. So, we're looking to actually bring some of the nanotechnologies that we've partnered with, some of the companies, which we're going to announce in the next couple of weeks. One of the companies is really the leading nano, cannabinoid company in the world, patents and everything, and they even have the machines to test the particle size. But on the THC side, nano is really going to revolutionize the industry, because there's states that are passing regulations that are restricting the amount of THC that you can put into a product. And so the way around that is just nanotize the particle, make it smaller, make it easier to absorb in your body.
Smaller dosages.
But the thing I really love about it is that it leaves you faster. So you don't have that, like that edible effect where
12 hours later
you're still like in a daze and or a haze. And so that's one of the exciting things about, the industry is some of the delivery methods. And as you know, the way you deliver a cannabinoid is most important. I mean, it doesn't matter which cannabinoid you're using. If you're delivering it different, each way you deliver it is going to have a different effect. So
I think that's really exciting too. On the topic of the rares, are all what I call CBD plus products that we can afford to make now, as well as especially as the rares come online with the rapidly falling price of the raw materials for CBD. We can now afford to really give people some of these research paper dosages that I've read about, right? So a lot of people, Ryan, they don't remember that if you go back into the 60s and 70s and you begin reading the research papers on CBD, you actually will find research papers that will talk about how CBD is produces wakefulness in people in low dosages, things like 50 milligrams or lower. So, now you want to talk about making cool sleep concoctions and sleep tinctures. Well, what if we put a tincture where it's got 3,000 6,000 milligrams of CBD in there. So people get 100 mgs of CBD and, 10 or 15 milligrams of CBN.
You can balance it out, right?
We can start to make some really cool stuff.
Yeah. And the best sleep formulations right now that we're experimenting with, you put a little bit of THC.
Yeah, a little THC.
You put a little bit of CBG, which helps open up that receptor, and then it delivers that CBN. So the THC helps you go to sleep, so it helps you actually get tired. CBN by itself, pure CBN, it's not actually gonna make you tired. But when you do go to sleep, you just have like a really deep night of sleep, and that's what's so special about it. You could be on an airplane and literally, have a connecting flight, and you leave at midnight, like I did last week, to go to New York for some interviews, and I only got 3 hours of sleep, but I took my CBN before the flight, and that 3 hours of sleep was probably the equivalent of somebody's 8 hours of sleep because I was out cold.
Yeah, and I think, again, the cool part about all of these cannabinoids we're talking about is so far the safety profiles of these plant-derived cannabinoids are very safe.
Yeah, they're plants.
And so people can try these products safely at the dosages that we're selling and see if they work for them, right? Without having to worry about the long-term side effects of being on a medication like Ambien, right? Furcini, what sort of rares are you guys seeing in Star that are coming online that you're working with?
Yeah, customer requests. What are you seeing for customer requests?
Well, CBN is really the big one for us as well. Yeah. Everyone wants to figure out a way to sleep. No one's sleeping anymore. I mean, how many people do you know? How many family members do you have who can't sleep anymore?
Not me.
Exactly.
A lot.
I can't sleep.
There's a lot.
Yeah. We're here working all the time.
CBN, I would say, is our biggest minor that's coming on. I've also heard interesting things about CBDA, and all the acids being also bioavailability.
Interesting. Yeah.
Interesting. It's just nothing academically based yet, but clinical trials of just some professionals talking about CBDA.
Yeah, I do think we're getting closer. CBDA is hard to find for some people, but there are a lot of raw blends now where it can be like a 50-50 CBD, CBDA.
It's only hard to find because a lot of the manufacturers, a lot of the brands,
they're decarbing it all.
Yeah, that's right. So like one of the products that we're making is we have these dog treats, and in Texas they have to call them dog biscuits. Apparently, you can't call it a treat. But anyways, it's made from cold pressed hemp flour. And they add seeds to the press because if you're just pressing hemp flour, you would just get a resin. So they add seeds to it: sunflower seeds, flax seeds, hemp seeds, and the seeds from the oil from the seeds mixed with the flour resin. And so out one side of these machines comes this beautiful oil, and out the other side comes this pulp, this powder that we use to then create these dog biscuits. And they're loaded with CBDA because obviously
CBDA.
no heat's hit it. And animals can much more easily absorb, plants. So,
the CBDA is powerful. The acidic form goes to one of the old stories people always tell of the example of the acidic form. So you understand how listeners can understand how this works is Native Americans, right? They would pick a bud off of a weed or cannabis plant, right? Or a hemp plant. And they would just put that in the inside of their gum and suck on that bud if they were nauseous. And they would not feel like they wanted to throw up as much. And that is an example of the acidic form of the THCA and CBDA that naturally exists in that plant, absorbing through their gums, interacting with their brain and making them feel less nauseous.
I also love to tell people that, things in nature are really like perfectly designed, right? And, nature created almost like a child-resistant, product with cannabis in general, because unless you heat it, right, you're not going to get high. So they make these kids, they make these childproof. They make you have to when you buy your weed from the dispensary, you got to put it in a childproof thing. And I'm always thinking, like,
well, hey,
if a kid eats it, he's not going to get high. So
I can tell you what, for me and my brand, Amy and I were actually working on it this week. All the childproof stuff is going away because we'll literally have older patients contact us and say, hey, if you sell me a tincture with a childproof lid, my rheumatoid arthritis, like my knuckles are freaking all torn up. I can't even open this. give me something that's
it's
super
really
easy to open.
it's really overkill on a lot of
It's so
things. I
overkill.
mean, how many times does a kid go and take something out of the medicine cabinet and start drinking it? I mean, I don't know.
Yeah, well, especially with a safe product.
If they're trying to do that, a little childproof thing, it probably isn't going to stop them. But
I think the nice part about the cannabinoid revolution here is that the safety profiles of all these products are going to be really, really well defined.
I agree.
Hey, Dr. D, remember your mom?
That's right.
She couldn't even cut an apple, and your dad loves apple pie, and she couldn't even make apple pie. So
Yeah,
she probably wouldn't have been able, because she has arthritis in her thumb, right?
in her thumb. So she had arthritis in her thumb really badly for a long time, and she's an example of someone that went and did the go low, go slow approach. As we know, lots of inflammatory conditions don't respond overnight. And after a month or two of being on CBD oil full spec, she was able to see her thumb actually get a lot better. So that's just another example of working with the products over time and not just expecting things to work overnight.
I mean, it's a shame that I'm not the scientist here, Dr. D, but it's a shame that we haven't dedicated the last 40, 50 years of research and funding towards cannabis plants, because there's a lot of effects that we just don't know really what they can do yet to help people with their problems. Me personally, I actually have epilepsy, and I jumped off the medication and went entirely with CBD now.
Wow.
And it's amazing. I can live a normal life. That's
because the other medication, was it affecting you with side effects like weight or mood?
I couldn't even get out of bed. I didn't even want to leave. It was horrible.
Yeah,
anything that has to do with the brain, it's scary.
Well, and when I think of you, Ryan, I think you and I have like a lot of commonalities. I think of you as a nice looking, tall gentleman with a quirky sense of humor, who's a funny guy, kind of reminds me of myself sometimes. So even like thinking of you having those issues, it's like, man, that's not the Ryan that I know.
You know what's crazy is that,
but it's so common, and that's, it's cool that you're open to even talking about that, right? That's awesome.
Yeah, thanks for sharing. One of the things that's crazy about cannabis and the history of it, when you really dive into it, I've, Raphael Mechoulam, who discovered THC and CBD, who, I've spent time with, and he's also was interviewed for my book that's coming up.
We heard about that.
The ultimate guide to CBD remedies. It's going to be books being released on 420, book launch party in New York. We're going to be like Good Morning America, the whole 9 yards.
We should all go do the show. Let's bring some products.
Cool stuff. So Mechoulam was actually interviewed for the book, along with Rick Simpson and some other notable experts in the industry. And but one of the things that Mechoulam, one of the slides during his presentation that he gives, which I've seen several of his presentations. This one was at Colorado State University several years ago. But on one of his slides, he talks about the history of cannabis, and he shows ancient hieroglyphics, from Egyptian, pyramids that they uncovered. And we're talking, thousands and thousands of years ago. And in these hieroglyphics, they actually show a cannabis plant being used to treat the epileptic seizures of some royal. And that was a really powerful slide to me, because it just shows you how we've evolved as humans to use this plant for its medicinal purposes.
So Ryan, I'm going to jump in there. I would love to keep this going, maybe once a week with you guys. I have a whole stack of like the history of cannabis from the early, basically 1700s, tracing it all the way up through present day. A lot of the research papers that came out with it are ignored. And really interesting. And I think one of the points you talk about is Ryan, you brought up cannabis has this long history with humans. And some of the folks that I want to bring on this show that I find some of the most interesting stuff is the guys and girls that are studying the impact that THC, CBD, and hemp and cannabis had on humans' DNA, and how you can actually literally trace the genes and the DNA of humans back, and you can see basically selection on our DNA and impacts of those subpopulations of humans that used cannabis. Specifically, you can even see certain populations of folks that have maybe upregulated genes that process, or they do better with psychoactive THC type cultivars that are rich in that versus lower. Anyways, really interesting stuff that I think, again, people are just mystified about what a lot of what we do is every day in the space. And, this is all part of what we do. And
breaking the stigma.
Yeah, breaking the stigma and then learning about the history and how things interact with DNA. All of this is stuff that allows us to really break what we know in big pharma is a 17-year-long drug development pipeline, and to bring about products for people to try to see if they work really, really rapidly based on early research.
And, I love to say this because a lot of people don't know, but marijuana was really outlawed and demonized because of hemp. Right. A lot of people don't know that, but hemp in the, hemp was always obviously, it's much easier you can grow hemp in 3 months and make paper. It takes years to grow trees. So it was a threat to that industry. Right. But if you look back at when the government decided to outlaw cannabis entirely, then you go and read some of the transcripts from the congressional hearings that happened in the 1930s. The government brought in experts who testified that there was no difference between marijuana and hemp, therefore both should be banned. They literally, testified that under oath. And the reality is if you look at the same time, the DuPont Chemical Company, which was like the Apple computer of the era, all the biggest, wealthiest, most influential people in the United States were investors in DuPont.
Correct.
And they created, during this time, the first synthetic fiber in the world. It was called nylon. And so it was really, they colluded to basically demonize cannabis, get hemp lumped into it, so that all the hemp fibers that were used for rope and textiles and all different types of things would have to be replaced by nylon.
Right.
And so, you can really go all the way back. It's all about money. It's about greed.
Yeah.
And
1937.
What they ended up doing was, I believe, they created essentially a nutrient deficiency in our diet because, cannabis was used as a medicine. If you had certain ailments, you would go down to the pharmacy and they had cannabis oil. Cannabis hemp was used as feedstock for animals. Right. It was cheap. It was easy. The hemp seed is a superfood. It has all the
it's
essential aminos,
the
the
correct
omegas,
balance of healthy fats, gamma-linolenic acid.
And
listen to us. We are smart people.
But this is the real history here. This is what we're talking about.
Yeah.
Even religion, ancient China, Taoist religion, there's a goddess named Magoo who can be seen strolling around with her basket full of hemp plants. I swear to God, it's a real thing.
I got a $10 bill at home, 1918 $10 bill, ordered it online. And it's not only made out of hemp paper, but when you look on the back of this 1918 Federal Reserve note for $10, they show a hemp farm being cultivated. You used to be able to pay your taxes with hemp. That's how important it was. And then during the war, I think it was the First World War, I think it was the Second World War, when the nylon production couldn't keep up with the demand for the products that the military needed. They actually passed a law to temporarily allow hemp to be grown again. That's why if you look back at some of the posters, you'll see hemp for victory. So they encouraged farmers to grow hemp again. And then as soon as the war was done, they banned it again. It was crazy.
Yeah. Hey, Dr. D, I just have to commend you on your branding because we have a very special viewer who goes by the name of Jesus Christ.
Welcome.
Oh my gosh.
It's an exciting time.
We're meeting him already.
He added a comment, cows ate it.
Cows ate it.
Mm-hmm.
Yeah, indeed.
And then we ate the cows.
Yep.
And that's how we got cannabinoids.
Yeah. And so, I think the point I want to make and transition off of what Ryan said of how normal this was over the past really centuries and how cannabis evolved with humans is how that parlays into how it needs to be normalized today, right? And as someone who has an appreciation of the plant and uses both CBD and THC products, and someone who knows lots of friends that have either chronic pain or ADHD or whatever, and I know some of these guys, they've worked for me, right? And I would far rather have that guy working for me to step out and use a little cannabis, which that person likes and does well with, right? Not everybody does super well when they smoke a little bit of cannabis.
That's because there's just a lot of things going on. That's why it's exciting what we're doing with the
someone
precision
that I know,
cannabinoid.
Right? And it also goes back to knowing the research and the studies. And when you see someone say, oh, cannabis is a gateway drug, or cannabis will decrease their productivity, or cannabis will make you fat or overweight, I just think back and I'm like, well, that's actually wrong. Epidemiological studies show that people that use cannabis have lower body weights, are more productive, they're happier, all these sorts of things than people that don't. And I would rather have somebody that works for me using a little bit of cannabis 3 times a day than having to take prescription ibuprofen or ADHD medicines like Adderall or whatnot. And
it's a good way to tell if they're a cop or not. It's like,
yeah,
okay,
for sure.
Here, hold on.
Hold on.
You are definitely smoke this.
That.
And if he doesn't smoke it, he's a cop.
So,
yeah, I would pare that back a little bit. It's all about biology too. Personally speaking, when I get high, I can't do my job the same way.
Right. So some people do well with it, some people don't.
Yeah, I actually haven't smoked marijuana in over a year.
Right.
That's just me. Just because exactly. I'm at a point. I'm just at a point in my career where I can't be slowed down. And it does slow you down very effectively, right?
Yeah, for some people, and for some people, it makes them focus. So
that's true.
Having that ability, I've just seen it, even in our industry.
Well, the other thing too, and then I'll let you go. The other thing too is that I have the crazy cannabinoid portfolio. Like I don't need THC.
Yeah, you have THCV, CBG.
That's CBN, CBC. I have everything. Like when you come to my house, and by the way, we have to do an episode, but when you come over, we have a dab rig set up. And this is what it looks like, okay? It's literally a dabber's wet dream. So you have all of the isolates. You have CBD isolate, CBG isolate, CBN THCV. Isolate, THCV, CBC isolate, right? And then here's a dab hack for everybody. You're going to love this one, okay? So everybody's into terpenes, right? We know that terpenes, these aromatic hydrocarbons, very synergistic with the cannabinoids. I like to tell people that if the cannabinoids are the engine, the terpenes are the gas. And so here's a good dab hack. You take the terps and you put a little bit in the water of your bong. That's what you do, or the water of your rig. And that's where you're going to get the terps. Because if you try to burn those terps, you're going to lose, half of them. And that's why, these cannabis plants, when they're curing them, you're losing like 70% of the terpenes anyways, by the time you go and smoke it. So you can imagine when you're able to isolate them during the extraction process. And a lot of the companies that, I'm very close with on the marijuana side that make these incredible blends, like the resins and stuff like that. So they trim the plants, right, when they're full flower, and they immediately freeze them. They do that to freeze all the terpenes, and then they go into their process to capture all the terpenes. So yeah, take your terps and put a little bit in the water of your rig, and then it's amazing. Full effect.
Yeah, terps are a powerful substance.
Yeah, by themselves. Yeah.
Even a coworker of mine who's a supplier for us, he was driving terps back to the facility, brand new BMW 7 Series. And the terps spill in the back of the trunk. He's cleaned the car 5 times, but it will never. It's that fresh car smell, but it's a little too much.
No, they're legit.
Oh, that's a lot.
Yeah.
What do you got, Jason?
Yes. Young lady wants to know: are you coming out with a CBD skincare line, Dr. D? And she would love to hear how it's manufactured from the Ryans.
Yeah. That's a great question. Yeah. So in Dr. D CBD brand right now, we're taking a real we have so many SKUs right now, and I've made multiple skincare brands or lines for multiple brands over the years. So we're really taking our time right now to get it right. So we're experimenting with Ryan, and we're working on different, hyaluronic acids. And for me, right, again, we have all these beautiful rare cannabinoids to play with. So the line that I really want to work and collaborate with everyone that we're talking to here is a multi-cannabinoid, terpene fortified, amazing, 3 to 4 part regimen to roll out, and then as well as hit specific indications down the line, such as tattoo care or after sun care or acne care.
And one of the things that we're doing, and that was a great question, because it's really become my fastest growing category at global cannabinoids. So, one of the reasons why I went out and I sought partnerships with some of the biggest manufacturers in the country that are making products for the biggest companies already is because, they have amazing botanicals already. They know the stability of them. They know how to formulate with them, and they know how to target specific conditions. And what makes a great product in our industry, and, Dr. D knows this, is if you take the cannabinoids out of the product, correct, somebody would still use that product. And that's really most true for skincare. So, some of the things that we're doing is basically combining cannabinoids with trending ingredients correct in skincare.
Yeah,
so,
absolutely.
You mentioned hyaluronic acid. That's hot, right?
Yep.
And there's a lot of other, interesting ingredients that we're starting to combine with, our cannabinoid formulations. Propolis from beehives. Propolis has been proven, antibiotic. It can repair skin. It can do a lot of amazing things. We're putting that in our tattoo bombs.
Yeah. And so this is the power, right, of where you get folks like Furcini, folks like Ryan, folks like me, all sitting around chatting about this. And then, every lab has what it's really effective and good at and what we have access to now. And then being able to weave together this really powerful, beautiful brand, and have guys that like me and Ryan and Furcini, they're all working together. And
making products that work
and having fun, right?
Well, it's fun. You got it.
And we're all here to share the revenue that we create and, have a good time with it. And, that's a big part about me and my brand. I think that has gotten me, here is that, I'm here to have a great time, create great products. Yeah.
But you
create friendships and help everyone make more money.
That's how we met, Dr. D. I mean, Dr. D, I built one of the first large scale vertically integrated hemp farms in the country to produce cannabinoids. And Dr. D came out to Colorado, when I was out there, in the trenches. And he wanted to see the farm. He wanted to see the extraction. He wanted to see every aspect of how the product was made. And, that just goes to show that, he really cares about the products that he's making. And, that's something that I commend Dr. D for. So a lot of companies don't necessarily put that
you have to,
thought
right?
into it,
It's just there's so many people out there that want to tell the story. And then we know enough to ask the questions where you can rapidly understand if they're kind of BSing. And Furcini, hey, why don't you jump in on what's a skincare product that you're kind of excited about, man? What are you having fun with making? And then I want to share some funny kind of fails that I've had in skincare world.
Oh man, well, what we've really been working on lately is it's not so much skincare as it is just a cosmetic.
Okay.
Making a rose mist.
Oh, that is super popular.
The interesting thing about most of the CBD products, not most, all CBD oils, they're not water soluble. Obviously, oil doesn't mix with water. So finding a good way to suspend the oil in the water and then adding a natural rose essential oil to the water just to make a nice refreshing mist for the ladies.
And now are you doing, or Dr. D, I might have my face, or Ryan. Our faces might be a little dry, Ryan. Don't limit to the ladies.
Vegas, it's really dry.
So are you doing a pump powered or is it aerosol powered or how are you guys doing it?
Just doing a hand fine mist sprayer, just real basic.
Little schwitz.
Yeah.
Yeah, little schnitz, yeah.
Schwitz.
It's
Yiddish.
okay.
Schwitz.
I do think that's a core bestseller. What else you got, Jason?
Yeah, Dr. D. You want to talk about the Dr. D CBD energy capsules because we have a member of the team who's like passed out. Right now.
Well, he obviously didn't take it.
He took one last night and he stayed up until like 1.
I think he needs the Dr. D energy suppository.
Long. Hey, Long. Oh, we're gonna help you out with one of these energy capsules, buddy. If you don't wake up, we take care of our crew. So these are actually Ryan. The gentleman Augie who helped make these for Furcini, correct?
Yes.
So what can you tell us a little bit about Augie's background? Because I can tell you that these energy capsules
I'm flying.
Work like
I'm
crazy,
flying.
bro.
I love them.
I mean, everybody loves them, from Jason's wife to our, executive assistant, operations manager, Long. I'm on one right now.
And what's great is that the CBD really, how a lot of energy things.
There is no jitters. I am just like
it takes
super focused. So if you guys haven't tried the Dr. D CBD energy caps, they rock. They're affordable. They're actually less expensive than most brands charge for a 1,500 milligram CBD.
You do have to tell. Okay, so
boom.
You always have the most interesting ingredients in your products, Dr. D. I remember
this is an interesting.
There's one product that has anise in it.
Anise. That's a flower.
Okay.
That is a flower.
All right. Well, this product, you do not disappoint me with either. It has caterpillar fungus. So you got to tell us about the caterpillar fungus.
There's some active ingredients in caterpillar fungus which are energizing, and I really want to bring on. We really need to bring on Augie, okay, who I have talked to. Here we go. The energy capsules, everyone. There we go. Okay. We should bring on Augie, and we should do a special show where we go through some of these really novel formulas, and he and I can break down exactly. I mean, Augie loves this stuff. Yeah. So I think actually, Furcini, what you might have to do, because Augie, I don't know how, up to speed he is on his app on his phone. You might have to get with him and call in, via Skype.
He won't be doing this on his own. I'll have to set the whole.
But I think he would love it. Yeah, but let's go through some of these ingredients in the energy capsules. We have yerba mate, which we know is a natural source of energizing substances, right? Like caffeine. We have caffeine at 300 milligrams. So that is as much caffeine as in a Bang energy drink that you took.
Explains a lot.
It explains so many things.
When I start texting you at 3:30 in the morning, okay, you'll know why.
These things do not fail. Green tea, right? Extract, which again has other things in it, which we know. Korean ginseng for focus. Gotu kola, B12, kudzu root, and then we have the anti-inflammatory relaxing agents, palmitoyl, ethanolamide, and CBD. So yeah, we'll go through these in detail, and actually, what I'll do is on the topics. We'll do a specific show on the energy capsule, on the sleep capsule.
Can we do a shot? Can we make a shot out of these ingredients? Can we get that in?
That's a really good idea. So this is another way where we could all collaborate. Is I have been we could even maybe mix it into a soft gel.
Ryan, can we get Furcini? Can we get these ingredients in a shot? Does that caterpillar fungus?
We just have to see how it stays in solution.
Can I see what that looks like?
All those are water soluble except for the CBD or any sort of cannabinoid oil that we add to it. So we could suspend it though.
Right. Or encapsulate it. There's a lot of things we can do.
Yes.
Yeah. So this blows 5-hour energy like out of the water.
Yeah. A lot of things do.
Yeah, a lot of things do. Guys, there it is. The next collaborative project. Let's do it. Let's do it together. Split the dollars up. Have
I
fun.
would love to know more about like what some of the people that are listening to this great podcast think, and some of the products that they're interested in. Anybody listening, if you want to chime in and tell us some of the things that maybe you're interested in that maybe you haven't seen yet, we'll manufacture it,
Yes. And that's that, listening to the population.
Feedback,
right?
Data.
So, and I think, Ryan, so this is why, and Furcini, why this is so exciting, right? Because right now is basically our warm up soft launch week where we are hanging out, getting some content in the can on these podcasts and showing all of our friends and contacts from across the country and really world. I mean, I've got people that want to do this that are in Amsterdam, that are some of the premier shop owners, seed owners, Japan,
Australia,
Africa. I mean, all over the East Coast, South Korea.
So
it's Australia, LA. Yeah. So, I mean,
one of the things that's really exciting is talking about the global is that there's countries around the world, they will not be growing hemp anytime soon.
No, but they could call us and talk to us.
Well,
about
that's right.
this.
And they all want American grown cannabinoids. And that's another beautiful thing. When I got started in this industry about 5 years ago, the hemp in 2013, 14, all the CBD that to be legal had to be imported, and it was from China and Europe. And the hemp that was coming in, the hemp that's grown over there, is grown for fiber and seed. So it's, characterized by a long stalk and stem. And the plants happen to produce a very small amount of cannabinoids. So when the Farm Bill passed in 14, that really changed the game, because the section 7606 of the 2014 U.S. Farm Bill stated the definition of hemp as any cannabis sativa L that produces naturally less than 0.3% delta 9 THC on a dry weight basis. And when I read that, I was like, oh my God, so if I can get Blue Dream or Sour Diesel to produce less than 0.3%. I can grow thousands of acres of it.
Right.
And so I just saw that opportunity before a lot of people. I had a lot of friends in the marijuana industry who were like, oh, hemp, that's not medicine, right? Because they were associating hemp with the fiber and seed, which they're right. It's really not medicinal. But they were missing out on the new definition of hemp, right? And the fact that there was varieties of cannabis that were being bred to produce less THC and higher amounts of cannabinoids, and then was born the U.S. hemp industry, which is just dominating.
And here's the power of what we're all about to do, guys, right? So this is our warm-up week where we're getting some content so everyone can see what we're doing, and then inviting all of our networks to this basically global interview series covering our industry, because next week, my database goes live. We are going to begin reaching out to the hundreds of thousands of patients from across the United States that have come through all of my systems. We're launching multiple new telemedicine systems. So we're going to have people from all over the United States calling in, and then we're going to be inviting everyone to these groups where these live streams will be done. So the viewership now, we have several sites, Twitter, where we're seeing a couple hundred people watch us live. We expect that to rapidly scale into the thousands of people tuning in live to this, because this is such a dynamic industry. And between our networks, we really are.
I mean, we're giving the real, we're giving the legit information awesome. Here. I mean, a lot of what you read is, quite frankly, there's a lot of BS out there about a lot of different things. There's so many, I see all these articles that are praising and basically pumping these products. They're articles that are paid for, and they're products that, quite frankly, are garbage.
Yeah, and so there's no one behind the product. I mean,
they're just they're not formulated, effectively.
So we got a question from Jace.
Yeah, go ahead.
Yeah, so someone had a suggestion for Ryan from Global Cannabinoids. Pre-workout, and as a former professional basketball player and personal trainer, it kind of sounds like the energy capsule would gotta be like halfway there. You just have to add some stuff to it for a pre-workout, right?
Yeah, pre-workout.
I think we've all been working on
energy.
That
I mean, before you go and work out, you definitely want, you're looking for something to get you energized, right? But what I love about the cannabinoids in general, and they were actually, and it might still actually be true. Cannabinoids were listed as a performance-enhancing drug, right, with the Olympics.
They were, and
part of the reason is that, number one, it can reduce stress and anxiety. So think about before a competition, you get a little anxiety. So if you don't have that, you're at an advantage against a competitor that might be anxious about what's going to happen. And then secondly, those anti-inflammatory benefits. It's very possible that you can push through pain thresholds. So, it's very possible that you can lift heavier, right? You can push yourself harder.
You might be able to,
by having the anti-inflammatory benefits.
And think about, I want to kind of consolidate in the viewers' minds about how specialized the group of people that's talking to you today is right now, because a lot of folks will say they're in the CBD industry, or they're hemp farmers, or they have an extraction operation or whatever, and they're making CBD. And a lot of people put millions of dollars into that, and they set up maybe a tincture line, and they can make a tincture. Well, that was cool a few years ago. And now a lot of folks that just did that are regretting it, because they can only make one thing, and everybody can make a tincture now and can go source and buy CBD at a very low price on the wholesale market. But what you have here is you have a team of folks that basically have the formulary, all of the best raw materials from every source, every supplier in the industry. And that's not just farms, that's chemists that have made things water soluble as well. So when we are talking about formulating a pre-workout powder, not only have people like Ryan from Global Cannabinoids and Furcini from Star worked with a water soluble powder, their teams have experience working with all of the best water soluble powders on the market, and seeing which one specifically works the best in a given application: skincare, powder, drink mixes, whatever.
And one of the things to build on that, one of the biggest issues that a lot of these cannabis companies have, especially CBD, is that they always think they can do it better than somebody else. If we do it ourselves, we're going to make more money. We're going to buy the machine to do it.
Slows them down.
And I always knew that there's just things I'm never going to be the best at. So I'm going to seek the people out that are the absolute best at what they do. I partner with those people, and then we produce the best products. I mean, that's the bottom line.
And
here.
that's even a way where there's collaboration between all of the leading best manufacturers, right? Someone might have an order come in that Star can't maybe do, and maybe you can handle it, or maybe they have some opening in volume, and boom, boom. And
so there's a lot of reciprocity.
Yeah,
we work together just to create great products, and it's.
Jason's got another one. It looks like.
Yes, Jesus wants to know, is THCA...
Is that Jesus Christ, by the way?
Yeah.
Okay.
Is THCA legal like CBD in the USA?
It's actually, it's not
That's
regulated. So THCA is actually a completely separate molecule, okay? The word THC has a bad rap, obviously, because on the marijuana side, which it should really be called the THC industry, because the entire industry is based on the regulation of that single molecule THC. THC, now you said A, right? Yeah. So THCA, it's starting to get some attention because if you add fire to it, if you add heat to it, it will convert to THC. So it is starting to get a little bit of attention, but the reality is it is a completely different molecule. It will not get you high.
I can tell you as a doctor, it's definitely one of the ones that I'm going to be incorporated into products. Now you'll see other people that aren't so medically minded so I'm really about getting people the effective products, because I don't think overall the majority of people that buy one of my tinctures want to go home and drink 3 bottles of this so they get stoned. There's enough weed around that if someone wants to get high, they can go get weed. So I'm trying to make these tinctures that are the most medically minded, with not thinking about what someone that's going to go abuse my products are going to do. So I want to put THCA in a lot of products, from skincare to edibles and topicals or tinctures. And I want to do it as soon as possible. Some of the manufacturers have been having trouble either supplying that, or some folks are worried that if you sell someone a bottle with 1,500 milligrams of THCA in it, they go home and they heat that and it becomes
just
THC.
Just not likely. One of my dear friends,
unlikely.
One of my dear friends, Tracy Ryan, who, Can of Kids, Saving Sophie, actually all of the proceeds from the sales of my book go towards her foundation, Saving Sophie.
Tracy has a brand. It's in the same space as me, but Tracy's awesome, and she has her own wonderful journey and story. So we would love to, it's another great brand to support.
And so she told me that THCA is showing a lot of promise for parents who have, children with autism, right? So, it's so exciting about the things that we're learning about these cannabinoids that have been suppressed for so long. We're talking about the most medicinal plant on earth. That's literally what we're talking about. There's more medicinal compounds in cannabis than any other plant. I think the only thing that comes even close is maybe reishi mushrooms. There's a lot of interesting compounds in those.
Yeah. And I think that's the real beauty of what we've all created now, is that Furcini, Ryan, and I are now in the space so much, and in so much of the science. That we are now getting all of these scientists basically coming to us, or that we're learning about products at the conferences that are synergistic with the endocannabinoid system. And now that's something that's going to really separate us, is that we're going to have mushroom and CBD combinations
that's right. It's
on the menu soon.
It's all about those other ingredients, really. Again, you take CBD out. CBD is just an ingredient. These cannabinoids are just ingredients. So you want to be able to pull that out and just have a great product that works.
I got maybe another question. We can stick it to Furcini this time.
Yeah, we're almost doing an hour, so this might be a good wrap-up question for Furcini. So I just searched for this because we get a lot of questions about, they're interested in CBD, but they literally, like you and I, Dr. D, we talked to someone last Saturday that literally had tried 6 different brands of CBD and nothing worked. Right. And he tried our body lotion, and within 5 minutes, he's like, holy crap, this works. Yeah. So I'm looking up in Google, and here's some of the headlines. And some of this is 2020, like January 7th, 2020. Some CBD pet products contain virtually no CBD, NBC News. Patients are being duped, testing popular CBD products. Let me see. Test results can be alarming, CBD, another NBC in New York. Yeah. So, Furcini, what is your comments on, what people need to watch out for and the difference between you and Ryan from Global Cannabinoids?
Yeah, tell us all about the lab and the testing, Ryan, for sure. Furcini.
Well, we're a wholesale manufacturer, so we only make products for other people.
Companies.
And yes, other companies, exactly. So we wouldn't ever entertain business with anyone that would try to do that sort of thing. We only actually, when we're producing our products, we add 5% extra CBD to our blends. Even so, any nominal dosage, we'll add 5% extra just to make sure we always reach that threshold.
That's awesome.
So for us in the brands that we produce, we guarantee that we reach that dose because we have an in-house testing facility, so we can always reach that dose. We can always check the dose.
Small pilot runs, all that stuff.
Yeah,
exactly.
Exactly. And so at Global Cannabinoids, so all of our products are manufactured in OTC, which is over-the-counter drug manufacturing facilities, GMP facilities, or ISO facilities. And part of the protocols of those certifications is pretty intensive testing. So when we have our farms and extractions all over the country, they send everything to us in Vegas. We've created an entire quality control protocol where basically we test everything in-house, and then we also send it out to 2 labs. So we want to test those concentrates. We want to know exactly what's in them. Once we get the results back, as long as there's not any big variants, it's approved. Obviously, it's got to have no pesticides, no heavy metals, and those are, you got to look for those things with hemp plants too. I mean, I tell people the truth. Hemp can actually be a dangerous plant because unlike a lot of other plants, hemp is what's called a phytoremediator. So it can literally suck the toxins out of the soil. They actually planted hemp in Chernobyl, and there was a study done where a hemp plant literally could survive with a lethal dose of radioactive cadmium that it literally sucked out of the soil. So you got to test these plants, but we do it intensely. And I always tell people too that, the products that we're manufacturing, they're actually safer than probably the ingredients in your Cheerios. And so, once that product is, as a concentrate is approved, it either gets distributed in bulk or we manufacture it into different products. So like, for example, when we're making tinctures, we do large batches. So we'll formulate the tincture, in 55-gallon drums at a time. And then we'll test that formulation to make sure that, hey, every 30 ml bottle you fill is going to have, 1,005 milligrams. And and Ryan Furcini, you hit it on the head. I mean, as a manufacturer, you got to also factor in a little overage because when you're filling these things, there's a little loss of a material. So you want to make sure you hit it right on the head. And we've also perfected some of those processes as well. We know how much of a loss to anticipate, in various product manufacturing. And then once the product's made, as Dr. D knows, right, we then send it to the lab again as a finished product with his brand on it to then test it and make sure that it has the right dose. And from time to time, it happens where a product will come back and it won't pass our quality control and we'll have to make it over again. And that's just the reality, because the worst thing that can happen for us as a bulk and wholesale manufacturer, white label manufacturer and supplier, is one of our customers who's relying on our product to put their label on, puts it out in distribution, somebody tests it and it's not accurate. So we also use QR codes. So we've really implemented that across the board. We set up the QR code for our customer. They attach it to a link on their website. So when you scan it, you get that third-party test that comes up. So total transparency. And these are some of the things that we're doing to really police ourselves in the industry.
Yeah, I agree. It's the standard.
Yeah, full circle back to really, I think ultimately she wants to know is, hey, how do I distinguish between what's good and what's fake out there, what's crap? And I think you hit it on the head, Ryan, with QR codes. Any sort of product, you should be able to find a C of A for on that product. You should be able to find a certificate of analysis. You can email even like Dr. D, if someone emailed you, said, hey, show me what you got. Of course, you'd want to present them.
Yeah, they'd have a COA back in the within the hour.
And do your research online. I mean, there's investigative reporters that are pulling products off the shelf and testing them. And if you see a brand that didn't test,
I think it's pretty easy. This is one of the things too
for people to judge,
because we're here, right? We're putting our face behind this, and we've even had, and it's another reason why we also work with local labs, because again, there's a local trust. If there's an issue, you can drive to the lab, right? I know everyone. If something is an issue or someone has a question, I can call the PhD that runs the facility. And we've actually even had that happen.
Yeah.
You know, with the regulations changing so fast, we delivered a large order to Reef. One of the quality control intake product folks there had a question about a lab test. And within basically 45 minutes, the PhD lab director of DB Labs was on the phone with him. It was clarified, the order was accepted.
And one of the things that we've also had to be very cognizant of as a manufacturer and distributor nationwide, worldwide, is that different states have different, allowances of certain things, different testing methods. So, we use labs in various states actually, based on where the products are being distributed at. And I have certain labs. One in particular, fantastic lab in Florida. I'm going to give a shout out to Green Scientific.
Yeah.
My buddy Mike down there always takes care of us. Fantastic lab out of Florida. And what they're doing is all of their standards are basically set, all of their testing, levels of detection for, pesticides, heavy metals are set to whatever the lowest detection level is of any state in the union, right? So when you pass a test from them, it's good across the country. So that's another thing. We're looking for also amazing labs. We're working with amazing labs, and it's just important. This is important stuff.
Yeah, and again, I think it's a nice thing to be doing business with everyone here tonight, because we've all hit the phase where everyone's a professional. All these companies have enough money in the bank that we don't need to go to a lab where it's sketchy or that doesn't have a stellar reputation or pay for a fake lab result. That's not our jam. That's not our business.
We spend
a fortune.
Tens of thousands of dollars we spend a month on third-party testing.
I know a lab right now. It's like $1,000 tomorrow. Part of what our operating budget is. Yeah.
Damn.
So yeah, I think we'll wrap it up now. I think this is a good call. I think this is really something where we can continue to share products and successes and failures and give that inside view into how we're all working to bring you the Dr. D brand and really an amazing experience and inside view into the industry.
Yeah.
Share the fun.
Thanks for listening.
And links for Ryan and Ryan are in the description.
Love it.
Dr. D, what do you think about this? I think we do another podcast with both Ryans at both of their manufacturing facilities.
Yeah, that would be really beautiful,
be
because we can actually put out a rover, right? So our operations manager Long could take the Smooth.
He's awake now.
He could literally be roving around and looking at something while we're talking, and we could see what he's talking about.
Yeah, I mean, I would love to show how some of the products are made. I think that'd be great to show people. Get
that down, and then Furcini, I want to hear about the surf report right next week as well, San Diego, which is a good day to come back.
It's good motivation to get you a nice report.
I got my wetsuits hanging in my closet, man. The truck is ready. It's back. The solar panels are hooked up. We can go to the beach and we can get our work done and surf, man. It's going to happen.
I like the sound of that. Thank you.
Yeah.
All right.
Thanks Furcini.
Yeah. Thanks Furcini for coming on.
Right on. Hold it down in San Diego for us.
Thanks, Ryan, Dr. D.
Thank
everyone.
You.
If you have any follow-up questions for future episodes, feel free to leave in the comments, and we will see you next time. See you guys.
See everyone. Peace from Vegas.